Good morning, everyone. Super happy to be delivering this lecture in the World Symposium 2024, Digital Health Dermatology from San Francisco. My name is Dr. Yudara. I'm a consultant EM physician and an AI engineer scientist. Okay, let me take a pause. I know that's not something you see every day, right? Yes. I'm a consultant physician in emergency medicine, board certified for almost 15 years. But I start my technology career way before that. I start coding when I was 10 years old and continue all the way. After some time, I realized combining these forces is my path to forward. So 2022, I stopped practicing as a doctor full time and started HeHealth. And we have grown from HeHealth to Agee now. So I lead two companies, one in San Francisco, HeHealth Inc., and of course Agee AI, which is the broader arm which do provide all the AI services from Singapore. And happy to give this lecture. Let's start. Let me start from a story. 2019, I get a call from one of my good friends saying, thanks for being a good friend. Guys, don't message like this. And as an emergency physician, I have seen this many times. Sadly, in suicidal notes, I was so scared about my friend. We quickly rushed to his house, and I was so right. He was in a balcony, just about to jump and commit suicide. Luckily, we managed to stop him, bring him to the house, and ask what happened. He was initially hesitant to tell what happened. He said, "Look, I have done something stupid. I don't embarrass myself. I rather die." And he's a married person with a kid, and I knew his family. So he was not willing to share the story because he thought we will judge. I told him, "Look, let me help you as a doctor. Tell me what happened." Then he said, "I have HIV." I was like, "Wait, I know your health records as the doctor. You did not have HIV a few months ago. Of course you can get it, but how come I didn't know about the new results?" He said, "Oh, I didn't do a blood test." Then I asked, "How do you know you have HIV?" He said, "I have Google and I have all the symptoms." I was like, "Wait, it doesn't happen like that." Then he finally started sharing. He had unprotected sex with someone who just met, and after that he saw a rash on his penis, and he thought it's something serious. He started Googling about it. Sadly, he got all the wrong information. More he read with the fear in his mind, all the wrong assumptions he made. That, as a physician and a scientist and an engineer, I ask myself, why the men cannot get the personalized information when they need as they need, without stigma. And he's not alone. There are more than 10,000 people every single year asking questions about sexual health on Reddit. And me and my team did a very interesting study. We analyzed more than 100 posts and realized more than 60% the answers the users get are completely wrong. It's like one blind guy asking another blind guy, how does the elephant looks like? One guy said he touched the leg and said, "Oh, it's a cylindrical thing." And the other guy touched the ear and say, "Oh, it's like a disc." So most of the time the information they get is wrong. And I ask myself, how come guys cannot get personalized information without stigma at the current age when the technology is so mature? And let me tell you some crazy facts. There are about more than 1 million STI new cases every single day globally. That's way more than COVID. And that's not alone. The WHO report last year tells that average time to get a diagnosis for these STI patients after starting symptoms is about 3 months. Let me repeat this again. A person to get a diagnosis after starting symptoms takes about average 3 months. This is not acceptable, guys. How come this takes? And the problem is, while they are waiting for the diagnosis for that 3 months, most of them they will continue to have sex and spreading this disease. That's why STIs are still growing significantly. And in US, there's about 16 billion is costing every single year for the government to handle these STIs. And my team again go into the research mode and ask, why is this? And we did local research, and I'm quoting the WHO report itself. We realized one of the biggest problem in this sector is stigma and inaccessibility. That is the elephant which nobody wants to talk, because of the stigma. Like my friend, he don't want to ask. He would rather die than asking these things or embarrassing himself. People think that everybody will judge, and that's something we need to address. I think when it comes to stigma and judgment, machines do a much better job than humans. And second part, the same WHO report says the average doctor's clinical diagnostic accuracy of STI is as low as 50%. That's as good as you flip a coin and ask whether I have STI or not. This is not acceptable. And of course, the lack of understanding about STIs from the patients itself is not helping at all. With my friend's event, we decided to solve this problem once and forever using AI. We built the world's first STI detection system using AI for visually recognizable symptoms. For example, if you have a syphilis rancor on your penis, you're not sure what it is, you can use HeHealth's technology to understand what's going on and what you need to do next. It's simple as when you see a visual symptoms, you can just take a picture, answer a few questions like when is the last sexual contact, is there any other symptoms like pain, discharge, so on and so forth. Submit to our app. App will analyze this data using machine learning and artificial intelligence techniques, and it will able to tell you the possible diagnosis. And our accuracy can go up to 94% at this moment for visually recognizable symptoms. If you can remember from that doctor's 50% clinical accuracy, we are already hitting 94% clinical accuracy on this. And some of these things are compared to gold standard PCR test. So we are not even apple to apple in that sense. So what it means is anyone in the world who have a smartphone connected to internet can get the access super easy. Remember that 3 months through our processes, we bring it to within 1 day. The three biggest thing is it's accessible, it's accurate, and it's affordable. From usually STI check on developed countries, it might cost about $200 to $400, and we bring this cost from $200 to $400 to $0.1. That's in population level. Imagine how much impact we can do. Let me tell you a little bit about our tool in clinical settings. We are only operating in California and US at this moment. Of course, the rest of the world, they can get the information, but the whole clinical process is only in California at this moment. So what it means is someone having symptoms, they use our app, the AI will immediately analyze within a minute itself. They will give the initial possible detection results. And not only that, they will give you all the personalized information about this disease. And then within 24 hours, one of our team doctors will review just to make sure AI is not making mistakes. Of course, our AI is still at the early stage and it's maturing as we speak. So doctor will give you second opinion, and same time the patient have the chance to connect to one of our California registered primary care doctors immediately and then get the care they deserve. Remember that 3 months to get the diagnosis alone, we bring that to 1 day to get the treatment also. So that's what we call innovations, making the access accessible, making the patient's lives better. And not only that, we are super proud to share this part. We are the first team in the world to document using of AI specifically for taboo topics like penis health, and show that improves the patient's lives, and of course the clinical documentation of how we did it, how we collect the data, and what is the accuracies, and how we continue to going to grow. So when I share this news, a lot of people had a lot of questions, especially how did we collect the data enough? And of course we did. I'll touch a little bit on this. We did in a way that we took a stepwise approach. The first step, we of course start with internet. We run our own program to collect all the labeled internet data, and I create a very basic one. and then show it to my friends, especially venerologists, and they were impressed. They agreed to share anonymized patient data with the consent to us. And one of the biggest things we did is we also went to the community itself, and we tell my co-founder, he's an openly gay man. He is very well connected to gay communities. We go and tell them, look, we are doing such a project. We want data. Anyone willing to share the data, please do so. And boy, we got a lot of data from the community itself. And what we did is we use data, and then of course we use venerologists to clinically annotate them. Not only one, every single picture is annotated by two specialists. So that way we build the world's largest data set on this. And of course the ripple effect, we have more data and more people are coming, more partners are joining, so that we continue to grow. That's where we are right now. But all these things are clearly documented in this paper. And looking beyond, imagine we just come out of COVID. And I cannot say we come out, but we are still struggling with COVID. But if the next pandemic comes with dermatological presentations, cutaneous presentations, how would we handle this? We learn from COVID, but do you think that we will not do the same thing? I doubt. I honestly remember when we experienced SARS-CoV, 20 years ago, and we thought we learned the lessons, but when the COVID hit, we did the exact same mistakes. Guys, we can do better. Next slide, I'll show you something. What if? Not if, what if. It's when this is going to happen. We have to be better prepared. If you think that you have cutaneous symptoms, exactly what happens during when WHO declared that monkeypox is going to be a global emergency, and at that point it was restricted or majority present among MSMs, men who have sex with men. But during the HIV early days, we remember it was tabooed as a gay disease, but we all knew it is not. And in this case also, we knew it's not, but of course, because early stage it was confined or majority seen in the MSM community, people are not willing to come forward. I had many patients, they said they are bisexual, they are gay, they have men, they have sex with men. Same time, they might have families. They are married, they have children. So one person I still remember said, even if I die, I don't want to come out as a gay person and tell this, and my family will all leave. Anyway, so we thought about it. We were doing the HeHealth, and then we built the next thing, monkeypox screening tool using AI through pictures. We knew how to do it because we had the technology which is patented under us, and then we had capabilities who's handling the sensitive areas, for example penis and anus. So we built the first phase of the mpox data collection with 1,000 plus. We get geographical and other data from CDC and WHO publicly available. Instead of waiting 6 months or 1 year, we released the first digital screening tool for mpox within 2 months of WHO declaring as a global emergency. And we did a lot of technological advancements during that, and it was a very good learning exercise. So we managed, within these 2 months itself, we managed to hit accuracy about around 90% by just using pictures, and of course some other information like geolocation, and then of course your sexual preference, and so on and so forth. And again, we document this clearly, and we took a very different path. Instead of, as I said, going on linear path, collect the data, train the model, test on it, we stack it up. We did collect the data, training the model, testing on it, and then releasing and actually getting the public feedback all on the same time. That's why within 2 months, we did all these things and get the response and then continue to grow. I'm super happy about this also. We documented and published in peer-reviewed journal about our process, and we can learn. So finally, we can do better in the next pandemic. And I'm quite happy to tell we are developing technologies with synthetic data right now, which I have another lecture, which the next pandemic hits will be much, much better and faster to develop these technologies. And we talk about people being biased. Actually, AI is also being biased on sexual health. Let me tell. Actually, AI is not biased, but it based on people who train them. That's why you need some people who are honestly caring about the topic, working on the AI, specifically focusing on bias. Let me give you an example. If the LLMs are used by everybody, it's better than Google because it can personalize things. But what if a normal person have a sexual health problem, can ask from ChatGPT? Let's try. So I ask in simple terms, blah blah blah. I had sex with this person, and a lot of people don't know how to ask questions in scientific terms. So I use the word dick. I have something in dick coming out all the time. And then what does the OpenAI say? This content may violate our usage policies. And it refused to give you personalized information. It says just go to doctor. And we can do better. And then when I'm preparing these slides, to be honest, I ask AI to optimize some of the things, and it's sexual health. Look at this. This topic may not intended for magic, right? Try another topic. So even the AI is having bias towards the sexual health. It refuses to help me. So this is not right, guys. So we need to continue to push the boundaries so that we can actually grow on these topics. For that, we also created a complete separate LLM, large language model, completely based on WHO CDC sexual guidelines and some of the other curated content so that it can answer sexual health related questions without a bias or stigma. It can even guide you through all the necessary things. For example, we use it for sexual health education purposes, pre-consultation screening purposes, post-consultation screening purposes, follow-up processes. A lot of people, they get the medicine, go home and then realize, oh, I haven't asked this question. Do not worry, you can ask with Otis. We call it Otis. You can ask with Otis and it'll guide you through. And some funny stuff. You think we talk about people having bias and AI is having a bias, and how about innovators like us? Actually, a lot of people have bias towards us who's innovating in sexual health also. Luckily, my work is being globally recognized. We have more than 500 media articles, good and bad. Some people, of course, make fun. Jimmy Fallon make a big joke about us in one of his shows. Of course, BBC was trying to make people scared about these things. So that is the innovation. When you're creating something completely new in a very sensitive area, people get scared, which is very natural. But we continue in the right science way and continue to push. That's how we're going to change this world. And what's beyond. So let me take some time on this. I've been asked by Prof. Somesh to give this talk, which is one of my good friends, mentor and colleague. So we are not the only people in the world who do a lot of amazing work. Prof. Somesh group with us, and then with his own team, they do a lot of digital health related work in venerology and sexual health. So please go check his work, and I'm super proud to be saying I get mentored from him. And not only that, there are a few groups in the world who do quite a lot of work, especially this Melbourne sexual health group under Dr. Zhang. They do a lot of work. They also independently build something very similar to what we build at HeHealth. So digital tool which you can upload pictures, and then you can get possible answers on what you experiencing on your penis. And during the monkeypox, this Stanford group led by Dr. Alexandra was working on something very similar, and they have published their work. Sorry about that. They have published their work, and super amazing. They built a monkeypox screening tool very similar to HeHealth, and they have done extensive work on validation, the mission capabilities, and so on and so forth. And again, all this combined, including us, what's next? So HeHealth and my team is in contact and discussing with WHO to bring these technologies to the global scene, especially in the Africa right now. And if you are interested of using these technologies, we are very interested to bring to your hands. And one last slide before I close my lecture. I'm doing a synthetic data lecture during this conference itself. Go check it out. And that's all. So thank you so much for this opportunity. I hope 20 minutes is barely touching what I can discuss and share. But if you have questions, please scan the QR code, find me in LinkedIn, and then drop me a message. I'm happy to talk. Thank you so much.